very excited to be reacting to House MD Season 1, Episode 20, Love Hurts. On this channel, we are reacting to all 177 House videos. This will be episode 48. Let's see if I can get the diagnosis before House does, as a doctor working in London.
So she's really coming back? You give her a raise?
Shut up. You lower her hours? You don't even know her.
You slept with her?
Keep talking. I'll finish your exam with a prostate check.
No medical interaction has been used more in comedy than the one, the only, the prostate exam. For us, the whole thing is routine, but I understand that some patients feel uncomfortable with the idea of a finger in their ear. I once had a 55-year-old patient ask me if he could do his own prostate exam. He caught me by surprise with that one, so after a second I said, even if you could reach it, which is very unlikely unless you have gymnastic flexibility, do you even know what you'd be looking for? And he said, a walnut. This won't be my first time. He caught me by surprise again, but I said, can you tell the difference between a normal walnut, a smooth walnut, and a lumpy walnut? So he agreed to the prostate check. Thankfully, it was a normal walnut with 2 lobes either side and a dip in the middle. Doctor life is many things, but dull is not one of them.
I've agreed to take her on one date.
What?
Damn it!
Who the hell walks around with an open urine sample?
$20 cash if you'll stop crying. Right pupil's blown.
You gave the guy a stroke?
Oh, now that is how you open a House episode. This is going to be an interesting one. A few things to note here. So first, it wasn't urine, it was apple juice. Second, now looking at the eye itself, when House shone the light, it didn't actually look blown as we would expect. A blown pupil is dilated and non-reactive, so the black part of the eye can be up to 9 millimeters wide. His looked like it was the same size as the other side and was about 3 to 4 millimeters, which is a normal size. Now, assume it is a blown pupil. What actually causes that? Well, the nerve that constricts the eye is the third nerve, but when there's damage directly to that nerve root, before it starts to spread out its function, then you also get a droopy eyelid, which we call ptosis. You get a squint because of dysfunction of the extraocular muscles, and the patient will complain of double vision. This patient doesn't have a squint, his eyes look aligned, his eyelid is still up. So what does that tell us? It tells us that the damage could be in the postganglionic short ciliary nerves, which just causes the pupillary signs that he has, but can also cause changes with the speed of the lens changing shape, which we wouldn't be able to assess at this point, considering the patient's unresponsive. We call damage to that area of the nerve a Holmes antipupil, which is what we call a tonic pupil. So there are some spicy House-esque causes of that, like viral infections, autoimmune conditions, which would be very interesting. Another possibility is it could just be physiological anisocoria, where pupils are different sizes without any concern, but that would be boring. So let's throw that in the diagnostic trash can and get more clues.
21-year-old male comes in with grinding of the teeth.
Totally blew out his pupil.
CT scan shows 2 things.
Ischemia. Death of brain tissue. Means there's been some damage, hopefully not permanent.
I hate to break it to Foreman, but generally, death is permanent. My job would be pretty useless if you could just switch the lights on and be back for round 2. Unless you've been bad in this life and want to avoid being reincarnated as a dung beetle. But he says ischemia and death of brain tissue. Those are 2 different things. Ischemia is when the supply of oxygen and the nutrients to a cell is insufficient compared to that cell's demand. That can be because of reduced blood flow or increased tissue requirements. Cell death can occur because of ischemia, but only if prolonged. Now, when Foreman says it's hopefully not permanent, he could mean that the symptoms aren't permanent, and that's because even though the dead area will stay that way, the brain has an incredible ability to remodel and compensate for that lost area. That happens better in children as they have higher levels of something we call neuroplasticity, which is the ability of the nervous system to change shape and activity in response to intrinsic or external stimuli by reorganizing its structure. A good example is a guy called Adam Fontaine, a Paralympian who had a stroke at the age of 7 and another at just 8 years old. He couldn't walk or use his left arm, needing to be in a wheelchair. he now can walk using splints and has won a Paralympic silver and a bronze medal in shooting. Amazing story. Now, grinding of the teeth could indicate stress or anxiety, or it could be a side effect of medication like antidepressants. It could be caused by ADHD, smoking, drinking too much caffeine or alcohol, and also one you won't be surprised to hear, recreational drugs, particularly ecstasy or MDMA, can make you grind.
Got to do an MRI.
You're looking at the wrong part of the scan.
The jaw.
Metal plate, angiogram to rule out vasculitis, EMG for peripheral neuropathy, tox screen to eliminate drugs, and echo to rule out cardiac emboli.
Alright, so he's had a jaw reconstruction with a metal plate put in, and House is investigating mainly why he has a stroke, but can't do an MRI because of the metal plate in his jaw. Now, a study was done by Mosher and colleagues back in 2018 that looked at the relevant literature on MRI safety with orthopedic implants. They found that the risk of significant displacement of the implants was infrequent, and that even if there were heating, it was less than 1 degree Celsius. So they concluded that MRI is generally safe as long as the risk to benefit ratio is there. Kind of a wishy-washy conclusion, but I guess they have to cover their backs. It does make this case more interesting that they can't do an MRI though, as it's likely whatever caused the patient's symptoms would have been picked up by an MRI. Or maybe that's what they want us to think and it's something totally different. Some Jedi mind tricks going on here. Let's see what comes back from House's flurry of tests here, but I would definitely want to add some tests like a HIV test, autoimmune screen, test for diabetes, high cholesterol, duplex ultrasound of the carotids to check for stenosis, and a 24-hour ECG to check for arrhythmias that can throw off clots to the brain.
I'm Annette. I'm Harvey's friend. Harvey's parents are dead. And no grandparents, or uncles, or aunts.
You do the talking.
I started grinding my...
Harvey's experiencing a little nominal aphasia.
There's an interesting dynamic going on between the friend here and Harvey, the patient. She seems a little overbearing and keen to shut down any chance of him having any relatives. That would make me a little bit suspicious that Harvey could be either being abused in some way, like through illegal slave trading, or is in the country illegally, maybe even both. In the UK, when we have concerns like this, we could do something known as a safeguarding referral, where social services can visit the house, check the family dynamics, and make sure all is well. It's important that we highlight these kinds of issues in healthcare, because so much of health is related to things other than just medical conditions. We call these the social determinants of health, like where someone's born, what family support they have, their level of education and economic stability. Like, it's tough to focus on eating 5 fruit and veg a day when there are 5 shootings a day in your neighborhood. Now, Annette mentioned something very interesting here. Harvey has nominal aphasia as a result of this stroke. This is a mild aphasia where patients have difficulty retrieving words and can't express what they would like to say directly. It differs from expressive or receptive aphasia, which are the damage to Broca's or Wernicke's area, which are usually on the left side of the brain, which are the centers for the production and understanding of language. Nominal aphasia is caused by damage usually to the left parietal lobe at the point of something called the arcuate fasciculus. It connects the front and the back of the brain, but we haven't quite been able to pinpoint its exact function yet. Just that when it's not working properly, you start getting the vocabulary of Jack Grealish.
Also says you're an encyclopedia of football. Where does that come from?
A what?
An encyclopedia of football.
I don't know what that means.
Now, Annette also said Harvey's parents apparently died 2 years ago in a car crash, but I would take that with a pinch of salt. Now, a question for you smart people. What is the biggest determining factor on which side of your brain your language centers are? Answers down below.
Have you had any treatment for the teeth grinding?
He saw an acupuncturist. She diagnosed liver chi stagnation and sent Harvey to a Shen balancer. He referred him to a homeopathic doctor who sent him to a chiropractor.
Liver chi stagnation as a cause of teeth grinding. Genius. Now, it's clear that Western medicine and traditional Chinese medicine have some fundamental differences. Where Western medicine focuses on anatomy and isolating the organ responsible for a patient's symptom and treating that, Chinese medicine focuses on the body's overall response to treatment and recognizes the body as one interconnected biosystem. Now, from a patient satisfaction perspective, Chinese medicine keeps up with Western medicine, and with one study showing higher patient satisfaction rates with Chinese medicine than Western. Although that was published in the Journal of Complementary Therapies in Medicine, so maybe a tad biased. In places that practice both Chinese and Western medicine, like Hong Kong, for example, residents pick and choose who they want to see based on what ailment they have. Generally, it's perceived that Chinese medicine is slower, dealing with the root cause of disease in more of a preventative way. Western medicine is fast, powerful, but sometimes too powerful and can lead to lots of side effects. It's worth noting though that acupuncture has had proven benefits for certain conditions like migraine or chronic pain. So it's definitely a good idea keeping an open mind about some of these things as long as it doesn't interfere with our Western medical treatment.
Hi, I'm having vaginal pain.
You have some vaginal tearing.
With all these male enhancements, the pressure to put out's incredible. It's worse than high school.
Many people think that Ramona over here would have lost her sexual desire decades ago, but the truth is very different. Yes, in this clinic setting, Myron, her partner, and his little blue pills was very much the instigator, but she was okay with trying it out. That's because sexual desire doesn't disappear with age. It may change in nature and intensity, but it remains there. A particular point of interest among older adults is entering a long-term care facility as well. For many, they're giving up homes, their independence, their jobs, their possessions, but one of the biggest things that they lose is their privacy. In a facility, it's difficult to express sexuality, and many older people begin to feel as though acting on their sexual desires while in an institution is wrong. Like, sex is just for the young and healthy. But sexual expression by residents in these institutions can even be seen as a behavioral problem rather than a sign of an underlying need for touch, closeness, and intimacy that isn't being fulfilled. But that's just one side of the coin. Now, on the other side, rates of STIs in the elderly are skyrocketing, and some states in the US are seeing a quadrupling of incidents. Yet, easy access to little blue pills is one cause, but the older adult version of Tinder, not needing to worry about getting pregnant, and high divorce rates also have a part to play. And if that wasn't crazy enough, one retirement community in Florida known as The Villages is actually known for its swingers community and black market Viagra. That's what happens when surgeons ask their patients to test out their new hip.
For vaginal estrogen suppositories. It'll help with the lubrication.
Maybe you could give Myron a prescription. Something weaker than he's got now.
You can't tell him the truth, so you want me to lie to him.
Something tells me that that is exactly what House is willing to do. If there's one thing he won't let get in the way of helping his patient, it's ethics. Vaginal estrogen is actually a pretty good alternative to hormone replacement therapy. After menopause, the lining of the vagina actually shrivels up, sort of like a grape to a raisin. That can lead to it becoming susceptible to infections and trauma, which is very painful. Estrogen cream can help maintain that lining of the vagina without the breast or ovarian cancer risk that systemic hormone replacement has. That's because negligible amounts of estrogen cream used in the vagina are actually absorbed, so safe to use for both comfort and preventing recurrent urine or vaginal infection. No wonder this episode is called Love Hurts.
Nerves stimulate muscles to move by creating a small electrical current. The machine will measure that. Sometimes it can be painful.
Okay, first he asked Cameron not to stop. Now his friend is watching keenly outside like, only I can punish him. And this patient's rolling his eyes into the back of his head like he needs a new hospital gown. That is not a friend, my friends. That is a dominatrix. That's the diagnosis. Can I go home now? Oh wait, I'm already in my bedroom. You see, even more reason to call this episode Love Hurts. Wow, we might be gunning for a triple meaning with this title.
The only abnormal test result we found was on the echo report. Mitral valve prolapse.
Could also be an aneurysm due to trauma.
Sorry, Chase. The gods have spoken. Start Harvey on blood thinners and antibiotics.
Nothing like a magic 8-ball to sharpen the diagnostic skills. Seems like Foreman's primary diagnostic here is endocarditis. Chase's diagnosis is carotid aneurysm due to trauma, but not knowing what kind of trauma caused it. But based on the interaction with Annette though, I think it's quite clear where the trauma came from. The fact that he also has a jaw implant probably is no accident either, and he's probably what we would call a masochist, someone who derives sexual gratification from their own pain. So speaking of trauma, the carotid arteries in the neck can be so vulnerable to damage, not just in producing an aneurysm like Chase suggested, but also in aortic dissection. I once saw a patient who was the 33-year-old male who was in a boxing match. He had been punched with such a force that twisted his head quickly and then became paralyzed on his left side. He was brought into us, and when we did a CT angio, we found that he had a carotid artery dissection on the right-hand side. It's a very scary injury where the inner layer of the artery, called the tunica intima, becomes separated from the media, and that creates a false lumen. So blood doesn't know whether to go through the normal artery or into this new gap between the innermost layer and the middle layer. And so the blood starts to build up, pushing a flap into the real lumen or pipe, blocking the blood flow. That is a vascular emergency and needs to be operated immediately to save brain function. That could be the diagnosis here as well. Let's find out more. Very interesting episode.
What the hell are you doing?
She's a dominatrix.
Harvey is an asphyxiophiliac. I was careful. I watched the monitors, made sure his O2 sats were over 90.
Careful? There's no point of there being enough oxygen in his blood if it can't get to his brain. See, lots of people think that strangling causes damage by reducing the amount of oxygen in the lungs and compressing the windpipe. If that was the case, it would take minutes for the patient to go unconscious because we actually have enough oxygen in our lungs to last a decent time without breathing, like when David Blaine decides to spend 5 minutes in an underwater tank with his legs tied together, for example. The thing that actually gets you with strangling is the choking of blood supply to the brain, and that can cause loss of consciousness within just 10 seconds. It's all fun and games until someone has a stroke, but that would only happen after 3 minutes of the brain being without oxygen.
You actually dated someone who likes to get burned?
I wouldn't have tortured you if I knew you liked it.
Ramona said I should come to you for my refill. I don't know how much more of this I can take.
You don't want more sex?
What? Neither of them want sex, and both of them think that the other one does. I've seen better communication from herringfish, a species which communicates using none other than the sound of their farts. I love science. Seems like Chase has brushed shoulders with this dominatrix himself, but only for someone else, apparently. Not sure I buy that, but he's been very accurate with his diagnoses since he snitched to Vogler, so I'd give him the benefit of the doubt on this one. Now, if you enjoy farting fish as much as I do, then check out the channel membership. You get priority reply to comments, early access to new videos, and being able to suggest a series and episode for me to react to. Those are some of the benefits. For a limited time only, the first 30 members will have a chance to win a 1-hour, one-on-one medical tutor session with me on a topic of your choice. We currently have 21 members and only 9 spots left, so make sure to join now to secure your space. The earlier you join, the earlier I can react to your suggestion as well. Press join now.
Got any blue pills?
There's a brand of acetaminophen.
Perfect. Fill her up.
I need you to squeeze with both hands.
Yeah.
Weakness in his right arm and hand. Harvey's having mini strokes.
Oh, this is getting very spicy. Harvey's on blood thinners and still having strokes. Interestingly, if he had the dissection that I was talking about, then those strokes or the neurological weakness could be dependent on his head position. If he looks to his right, he could trigger it, and looking back forward, he could be normal again. I doubt that's the diagnosis though, as it's probably a bit too simple. His symptoms do correspond with the left carotid artery territory still though, and props to the writer for picking up that rather than making his left hand weak, which wouldn't correspond to his speech disturbance, impressive. Autoimmune is something I definitely still want to explore, and even though they can't do an MRI, then a lumbar puncture would be very helpful. You could check it for signs of bacteria, viral and fungal infections, and demyelinating disorders by the presence of oligoclonal bands. Hypercoagulability is another potential cause. We also know that the mitral valve in his heart has prolapsed, so how could that be relevant? Maybe it's pointing to connective tissue disorder, which is an early sign of autoimmune disease like lupus. It would actually explain the symptoms here, to be honest. So would autoimmune thyroid disease, which can also cause the prolapse. Would definitely want to examine his neck, do a thyroid panel, and still want that autoimmune screen. If I got this, oh, that would be incredible.
You will have the surgery.
Where do you get off telling me what to do?
Get out! Emotional swings. He's having another stroke. He's crossing.
What exactly do they mean by he's crashing? Usually that means his heart is stopping, but his ECG from before the crash and after is basically identical. Seems to me like the only thing he's crashing here is his submissive routine. Now his eyes do look a little swollen. It could be that his mitral valve prolapse is getting worse, maybe because of undiagnosed lupus that he may or may not, probably not, have. Valvular heart disease is more dangerous than you think though. I remember during lockdown they stopped all non-emergency surgery at one point because of COVID risks, except for cancer surgery. Now, I was on cardiothoracics and we had a 58-year-old patient with what's known as critical aortic stenosis. So that's narrowing of the valve that exits the heart. And just 2 years after diagnosis, without surgery, the survival is less than 50%. That is worse than almost all except the most aggressive cancers. We had to wait until he came in as an emergency due to loss of consciousness before we were allowed to operate on him. Thankfully he was alright, but it could have easily gone the other way.
Mr. Park, your son Harvey is dead. We need you to identify the body. Trust me, he'll be dead real soon. Your son will be in surgery first thing in the morning.
Oh, a lot to go through here. House wanted to take the patient into surgery to fix the presumed carotid artery aneurysm, which hasn't even been confirmed on scan yet. But now the patient's unconscious and his last wish was that he didn't want the surgery, so the hospital lawyer said he needs to find a next of kin who are disgraced at their son's sexual preferences, but House told them that they would be even more disgraced if people found out they let their son die, and he'd make sure to tell every nail salon and dumpling shop what they did. And here they are, signing away. If a real doctor said even a tenth of what House says in this show, then their medical license will last as long as a TikTok attention span.
This is pretty lame, right?
It's beautiful. And you look very handsome.
What I am is what you need. I'm damaged.
Charming House. She asked you how you feel about her, and you gave her the back of the napkin psychoanalysis of her deepest insecurities. Looks like we've got a Casanova sequel underway. The truth is here though, as Wilson mentioned earlier in the episode, House feels lost. He doesn't want to open up because if he does and it doesn't work out, then it'll be because of him. There won't be any barrier or facade to hide behind anymore. It's also a big reason why so many people don't start projects that they would want to otherwise out of fear of being rejected. I had the same fear as well when I started this YouTube channel and a desire to always please people. A book that helped me immeasurably is called The Courage to be Disliked by Ichiro Kishimi. In it, they talk about how to overcome that fear through something called the separation of tasks. You can get it for free with a trial of Audible Premium Plus, link is in description. Every sign up, even for a free trial, helps the channel with a small kickback, so thank you for your support in using that link.
You two gonna do dinner again?
You don't think so?
Don't know.
No aneurysm, no nothing. This guy's clean.
You better get a full body scan. These breath mints you've been popping since yesterday, are they a new fetish?
I found them at Harvey's, because the guy's got a whole drawer of them.
Mints! Maybe it is endocarditis. Poor dental hygiene can lead to bacteria in the mouth, seeding onto the heart valves, causing the strokes. Another thing is if you had an overgrowth of bacteria called Streptococcus viridans, that could potentially lead to bad breath and could cause septic emboli. Either way, he would need to be nuked with domestos antibiotics, unless I'm missing something here, but come on House, I want to see that eureka moment. Also, House figured out the mint thing because the elderly couple came back and finally admitted to each other that neither of them want to actually have sex, and the man sprayed his mouth with a breath freshener. Gotta love those triggers.
Number one sign of fulminating osteomyelitis. Infected tissue from the jaw breaks off, blocks blood flow to the brain.
It was hidden from the scans by the metal plate.
Oh, osteomyelitis of the jaw. Now. That is an interesting diagnosis. Although there's definitely some medical question marks that need to be addressed on that one. Clots or infected tissue are not salmon. They don't swim upstream. So they will follow the flow of blood based on where it's going next. Believe it or not, to get from the jaw to the brain, you have to take a few stops first, through the right heart, and then the lungs, which are a capillary bed that act like a mesh net which would stop any material, then back to the left heart and up into the brain. The only way that they could bypass that process is if there is a hole between the right and left heart, like an atrial septal defect. That's definitely known to happen, and it's called a paradoxical embolism. That would be an incredible diagnosis. One thing though, it would have been picked up on the echo Foreman did earlier, and it wasn't, but things have been missed before. Another thing is that osteomyelitis is a severe, deep-seated infection of the bone and would likely make the patient have very high inflammatory markers which would show up on the blood. Also, if it were that severe, then the prosthesis wouldn't have been able to fully cover it, even on a CT scan, and he would have had intense pain in his jaw that would have given the game away. Although, maybe he enjoyed that pain too much to show. Interesting episode for sure, but there are much better ones in the series. 7 out of 10 entertainment, 6 out of 10 accuracy, 6 out of 10 diagnosis.
You have pus.
It's about being open and completely vulnerable to another person.
Lock him in a cage.
Lock him in a cage! House has the best comebacks. Is it too late to upgrade my entertainment rating? That gets at least another 0.5. Now this episode doesn't fully make sense until you watch the previous episode where House gets stuck in a meningitis outbreak. So watch that here. I'm Sermed. Stay curious, stay out of a cage.